The concept for the Contact Me IBS trial was triggered by the fact that we had a common condition, irritable bowel syndrome, affecting over 10% of the population. But we were struggling to recruit to trials because patients weren't in hospital clinics and they weren't even seeing their GPs very regularly. They were treating themselves by self-remedy and going to their local pharmacy. So we needed a way to reach out to them. And we designed a registry that was included recruitment to that registry from the community, such as pharmacies and GP practices. So the Contact Me IBS trial is quite a novel concept because it's a study looking at how effective social media recruitment is at delivering randomized patients into trials compared to standard routes of getting patients from clinics. But it also develops a registry that's part of the concept. You develop a registry, you use that registry to feed trials, and then you see what works best. So we're learning huge amounts from it. But one of the really effective things is having it as a portfolio adopted trial means that it's valuable for any NHS organisation to participate in. And we've had tremendous response from GPs all over the country reaching out to their patients, but also fantastic response from community pharmacies. And it's really powerful just to put a shelf wobbler up where the IBS products are, and you get lots of registrations from that. So it's been a really empowering way to recruit to a registry. We're only 2 years into building a registry, which is quite an early stage, but we already have 3,000 registered patients. And we've started feeding trials. We've recruited to 2 observational trials, and for each of those, within a week, we've had over 500 registrants to each trial. Now, the first of those had taken a year to try and recruit 1,000 and had only got to 470 patients in a year, and in a week we recruited another 530. And the second trial was a dietetic trial and had similar response rates. But the real power is whether you can recruit to interventional pharmaceutical trials. And we've done a mail out for 2 of these just very recently. And for each of those, we've had over 90 patients who have screened eligible to participate in the trial.